I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, Naturopathic Doctor.
Welcome to Women's Health Unplugged. I'm excited to be joined by one of my colleagues who we actually work together at our office in Burlington, Ontario at Clarity Health. Welcome, Dominique Vanier, to the episode today.
Thank you so much, Jordan. I'm so excited to be here.
I'm so excited to have you. I think that the timing of this conversation is really great for me specifically. So we're talking about bloating today. Yesterday was my daughter's 11th birthday and she loves hamburgers. And so we went to this just fantastic hamburger restaurant for dinner and we ordered all the things like the deep fried such and such and the breaded, all of the food, the jalapeno peppers, literally we ate all the things. And the abdominal discomfort that I experienced from that dinner was totally worth it, Sunday included. But it made me think actually about how much calmer I am about experiencing digestive distress based on my over time accumulated knowledge about bloating. Why I wanted to have this conversation with you is that this is a tough symptom for people to understand why they have that experience they're having. And then the what to do about it part is maybe double complicated.
Absolutely.
I'd love if you could just take a minute to introduce yourself to our audience, but also why you chose digestion as something that you wanted to focus on and maybe introduce that concept around bloating and why this is such an important topic.
Absolutely. Yeah. So digestion is really near and dear to my heart. And so I'm a naturopathic doctor, licensed in Ontario. And my main focus is GI health, particularly digestion, more like the functional, quote unquote, functional digestive disorders like irritable bowel syndrome. And so my journey really started just after I completed my undergrad and I started to experience really chronic, unexplained symptoms like bloating and food sensitivities and changes to bowel movements and gas. And I wasn't really able to explain it. After seeing several medical practitioners and having a colonoscopy at such a young age, I was diagnosed with pretty significant irritable bowel syndrome. And then fast forward several years, I just through my own path decided to change my career. I was working in downtown Toronto at that point and go back to school for the 4-year doctor degree at the Canadian College of Naturopathic Medicine and become a naturopathic doctor. And I felt from my own personal experience, I was really able to understand the trials and tribulations that patients with digestive issues experience on a day-to-day. So I really made it my life's mission to better understand the research and the effective treatment protocols that can help these individuals.
And so bloating's tough. And when I'm trying to explain it to patients around why it's so difficult, I use the same examples and the same metaphors over and over again. But part of it is that our ability to localize what is going on in our gut is not easy, right? And the other part of it is that so many things cause that symptom as well. So if patients are experiencing bloating, what are the causes of it? Because I feel like patients are always surprised when we talk through some of the possible reasons why you might be experiencing bloating.
Right. Absolutely. I as a practitioner, I do find bloating to be a little bit challenging when it's a standalone symptom. So I'm very interested in knowing everything else that's happening with the digestion and even actually other systems in the body, right? Because bloating is just not limited to what's going on in the gut. Sometimes there are hormonal causes of bloating, which we'll definitely go into. But things that are maybe as I'll say kind of simple as a lactose intolerance, right? Or a fructose or some other carbohydrate intolerance where somebody's experiencing bloating soon after a meal, right? So we can kind of deduce like what's going on there, maybe remove some foods, try to re-add them back in. But then there's several other causes of bloating, like irritable bowel syndrome, like potentially like an overgrowth, right, of bacteria in the small intestinal region. Sometimes there's like a musculoskeletal, like a nervous system aspect, or where like there's miscommunication between the brain and actually certain bowel muscles. And then like those that have chronic constipation, we're pretty much seeing bloating like in 90% of those patients. So it's really important to like systematically go through a list, right? And kind of start ruling in or ruling out what could possibly be causing bloating with this individual.
I think people jump to food, right? And we've talked about this on the podcast before, that I think that's rooted in so many things, right? Whether we want to consider that part of like diet culture, or like why I think the health and wellness industry has done us a bit of a disservice, and that we're always talking about how terrible certain food groups are. And so when patients have a symptom in their abdomen, I think it's really natural to want to blame the foods that they're eating to be the cause.
Definitely. And like an educational piece too is like, if a patient comes in and says, I think that there's food that's contributing to my bloating, I want to make sure I'm very clear on bloating is a subjective feeling where I feel like pressure or pain in my abdomen. But distension is like the objective term, right? So like, let's say that person then looks in the mirror and like they can visibly see like the diameter of their abdomen is larger. Like some patients will say, I feel like I'm 3 to 6 months pregnant. But yeah, like I would say food is a culprit that's kind of high up there. And when patients come in with like digestive disorders, there's almost always some sort of food intolerance, sensitivity aspect where like they feel like they're reacting to different foods. Yeah.
Yeah, I'd love if you could just explain that like distension versus bloating piece of like a little bit more in depth, because I find that so fascinating. And I remember stumbling across this idea where it was like, and the patients with bloating, if we measure their abdomen, like it's exactly the same.
Yeah.
But
Yes.
as a patient who's experienced bloating, I'm like, that can't be true, right? No,
Right.
it's not. It's not the same. My stomach is like way out to here. But if we actually like tape measure the abdomen of patients who are not claiming they're bloated, they are bloated, but there's this like a disconnect between like what physically is like feels like it's happening, but versus what is actually happening.
Totally. Yeah. And it even like gets drilled down to, is there actually an increase of fluid or gas in the abdomen? So there is when somebody is distended. So like there is like matter accumulating there that's pressing things out. But with bloating, that's actually not the case. The bloating is more my brain senses my gut is uncomfortable. So I feel subjectively bloated, but there's actually not necessarily an increase rate in fluid or gas in people that feel bloated. And so like the next kind of piece of the conversation is bloating is seen so commonly in something called visceral hypersensitivity, where like we feel very sensitive and pain and discomfort in like the organs in the abdominal cavity. And this is very much a hallmark of irritable bowel syndrome. And like with the pain too, right? Like we can talk too about like the neural pathways of pain, because pain can very much be involved with bloating. So you not only feel discomfort, but you can actually have like a heightened sense of pain.
And one of the things I think is so fascinating is that like we're not really able to like localize that pain, right? So even when we are pointing our finger at one spot in our abdomen, that might not necessarily be where the issue actually is.
Mm-hmm. Yeah, absolutely. Like often it's kind of diffuse, right? So it's like throughout the abdomen, the patient just feels discomfort and a diffuse sensation of pain. Now the question is like, how does this dissipate, right? Like we want to also think about, are you waking up and feeling this way throughout the entire day? Or are you starting to feel bloated or distended kind of as the day inches forward? And those are two very different things. And those are actually really important questions that I ask my patients, is like the daily pattern, if there is a pattern of pain, bloating, and distension.
And what would that difference mean? Like from like, if we're thinking from like a root cause perspective, like if someone wakes up and they're fine, but then, through the course of the day, you want to like flip to yoga pants partway through. Although let's be real, we're all wearing yoga pants 100% of the time now. But let's say hypothetically you wore jeans and you would like to take them off at some point during the day versus waking up with those symptoms. Like what is that teaching you about that patient?
Yeah, absolutely. I do find like a hallmark symptom of irritable bowel syndrome is bloating that progressively worsens throughout the day, and also that substantially improves with the bowel movement. Same thing with pain and the discomfort. If somebody is waking up with bloating that doesn't change throughout the day, they're just constantly bloated. I'm actually looking more at an ovarian cause, right? Because like there's definitely a red flag on my list at that point is, sometimes one of the only symptoms of ovarian cancer is just chronic bloating that does not seem to be related to the digestive function, as well as other ovarian causes like ovarian cysts we know can cause bloating, and then fibroids is as well in the hormonal category where patients will feel like that extra pressure and discomfort. So like the pattern of bloating is really important because I can start kind of putting things into buckets. Is this more digestion, or do we need to kind of go back to the drawing board and maybe do some extra imaging, such as a transvaginal ultrasound or a pelvic abdominal ultrasound, right? And make sure that we are doing our due diligence to like rule in and rule out all the potential causes there.
And I think so my experience when working with patients around digestion is that, for us as practitioners, there's a little bit of I'll call like an algorithm that we have to kind of move through this, like rule in, rule out. Like we need to figure out this sort of path that we're going to take patients on to, understand the cause, but then also like from a solutions perspective, it often takes us a little bit to figure out what's going to work.
Yeah.
And that's tough for patients because they would really love for us to understand their problem the minute we meet them. And also for us to have a solution 5 minutes later that's going to solve their bloating the next day. And I'm not saying that patients have unreasonable expectations. I think we've actually been set up to feel like that's a little bit how health happens. But that's just not what happens when we're working through digestion. Like what can patients expect from what would be a typical approach and how people should consider their digestive function and the treatment?
Yeah, like it's very much a process. This is not something where you like take a pill and then, 2 to 6 weeks later, we're all better. Digestion is, and I think it's because digestion is such a complex process. Like we've got an overlap with our immune system and our nervous system, right? Like there's links to our brain health and anxiety and depression and how that manifests, and then how that further affects our digestion. So I think it's really important to like walk patients through. We are going to take like a systematic approach, right? That's guided and evidence-based, but sometimes there's also a trial and error involvement. There often is, because patients actually often come to see me and they've tried all the things. And so like there is kind of a stepwise process. And then I think another important point is if it truly is like a digestive issue, like let's say irritable bowel syndrome, is like the literature and in practice shows that these patients are all heterogeneous, meaning that like they're quite different from each other. So sometimes that's a little bit tricky because something that will have worked quite well for somebody may not even be applicable to the next person, but they may have the same or very similar symptoms. And that is quite tricky, I would say, for both the patient and the practitioner.
Mm-hmm. And as patients are getting better, I think this is one of the things that I struggle with is like, how to track whether or not things are improving, because so I'll use my like birthday party hamburger situation from yesterday, right? Like my digestive functions quite well, but I can still have experience that symptom if the stars align, right? Making it sound like this burger just like plopped down out of the sky in front of me and I was forced to eat it. I chose all of those things, but like what I mean is that if we line up the right stress, lack of sleep, where you are in your menstrual cycle, and you go out for a birthday party, patients may be symptomatic, even if we're on the right track. And even if we're seeing progress in other areas, like how can patients keep track of whether or not their symptoms are getting better or worse, given how much things fluctuate?
That's a really good question. And so like something I talk about often is, yes, there is going to be fluctuations, right? Like this is absolutely not linear, but something to pay attention to is the intensity and the frequency and the number, right? Or like even the duration of how long an episode, quote, episode lasts for. So if you're finding that, let's say a patient is still feeling like constipated, but it's taking them less time to have a bowel movement, their bowel movements are more formed. Maybe they're having like less gas, feeling less bloated. They're maybe not back to zero. Like it's not perfect yet, but we're inching our way forward. That, in my opinion, is progress. Yeah.
Yeah. I love the way that you kind of phrase that, right? And those are even some things I maybe wouldn't have thought of to track, like how, yes, you're constipated, but how long did it take you to have a bowel movement? That one I wouldn't have caught. But I think that piece is so important, right? Like as I think one of the most challenging things about working with this population or people who are just experiencing bloating, period, is that because there's so many factors at play, we do our best to try and guide patients towards controlling most of those things all at once. But they still may experience symptoms from time to time. And to me, I always really like to like tie things up with such a nice little bow, right? Like, oh, you had acne before, now you don't. Oh, you had this before, now you don't. Whereas with digestion, like there's this constant ebb and flow, and then even sometimes just flat out relapse in symptoms, which I feel like is tough. It's like just emotionally for the patient, but also even as a practitioner, I find it hard.
Definitely. Yeah. And I do find too, like sometimes emotional triggers are just totally out of our control, right? Like, so certainly with a lot of patients, especially during the pandemic with like an uncontrolled level of stress, those are things that can kind of set us back because we know that stress and anxiety is a major trigger for these functional digestive symptoms. Another thing too, back just to your question there is like, how are we tracking progress or success is like, my goal for patients is never to be like cutting out all the foods, because this is totally unsustainable. And we know it leads to we know it can lead to nutritional deficiencies. But if patients, let's say, have less fear by going out to a restaurant, or maybe just feel better in general in social situations or social settings when they're consuming different foods, I would say that's a big win as well.
Mm-hmm. It's interesting. I stumbled on some research, maybe about a year ago when I was doing some work looking at IBS that gave specific journal prompts for patients with IBS about their bloating, their pain, the way their abdomen felt, their anxiety about leaving the house, how it was affecting their day. And actually by having the patients like journal, it was almost like it was supposed to be a gratitude journal, but it was like, it felt like when I was reading it, I'm like, this feels like the opposite of a gratitude journal, to like journal about your painful bloating. But that in and of itself actually improved patients' like subjective scores of their bloating over time. Like how much of this is can we train the nervous system to change, right? Like changing the way that our body feels about what's happening. Like how much of that is in our control?
Absolutely. That's a really good question. So like the brain is so intricately connected to the gut, right? So like always when somebody has irritable bowel syndrome, there's something going on with the communication between the brain and the gut. So we know that actually focusing on the brain is actually a key part of treatment plans. And it's pretty cool. Like the research shows that cognitive behavioral therapy and gut-based hypnotherapy have been shown to be effective in the treatment of GI disorders like IBS, in which bloating is the common cause. So we're talking about like the effectiveness in reducing symptoms and like overall quality of life. And then therefore, like somebody starts to feel better, even though we actually haven't done anything like regarding their gut. This is all brain support. So like that kind of probably leads to the question of like the brain is plastic, right? There's an element of plasticity. There's an element of retraining the nervous system. It does take a little while. So back to the whole, like this is a process rather than focusing on the outcome. But like patients can see dramatic improvement over time.
Mm-hmm. I've spent a lot of time looking at the pain research with endometriosis, and like that, like bloating is like such a commonly experienced symptom with that group of people as well. And it's interesting that I think we're still like a little ahead of ourselves, like in terms of talking about like chronic pain models with respect to endo and bloating and at that visceral hypersensitivity, meaning that like we think that the brain like is going to change so much over time that if we don't address these patients like in a timely fashion, that we could actually be setting them up for like a chronic pain syndrome that is never going to be, not that it's never going to be addressed, but it gets so much harder to treat. And then it's not about just like taking away the thing, right? So when we're talking about like the way your brain changes with chronic pain, it's like we could take the knife out of your abdomen, but your brain still thinks it's there for a long time afterwards. And I find that so fascinating. But the way that I also feel like we need to use that information is to educate patients on not waiting to get support or not putting up with or tolerating their discomfort, because as far as we can tell, the longer we wait, the harder it is for us to recover.
Yeah, absolutely. It's so fascinating. That's a really good point, because like often I'll see patients that have been like, I've suffered with this for 30 years. I'm like, oh, hey, I'm glad that you came. Like, this is really great that we're working on this now, but it's I think part of the challenge is like a lot of patients don't actually receive like the care that they're looking for, or even effective care, right? Conventionally, because we know like these functional digestive disorders sometimes are helped by medication, sometimes are not. Right. And so like people just end up living with this and kind of reach a threshold that's kind of manageable. They're in pain every day, but it's not 10 out of 10. And then they're finally ready to work on it. Yeah.
Yeah. And that was one of my questions, thinking about what you were saying earlier about the hormonal piece, right? Like I find that so interesting, and maybe you can just explain why that happens a little bit, or as much as we know about why that happens. But typically if people are going to be bloated with the menstrual cycle, it's in that second half of the menstrual cycle, like part of that whole PMS complex of symptoms, which can be confusing for people, right? Because it's like technically is like about half the month.
Yes.
But why does that happen? Like, and what do we understand at this moment for why we get that hormonal bloating?
Yeah, absolutely. Yeah. So there seems to be, well, at least what is thought in the literature is that there's fluctuations in estrogen and progesterone. And then those swings will then cause the body to hold on to like water and salt. So there may actually be distension, and then the subjective feeling of bloating. But another piece to this is like quite close to the period is that the progesterone, right, will spike just before, and then that can be constipating. And then we know that individuals who experience constipation, things can back up. Like we may actually have an increase of gas. We often feel bloated because we're not evacuating effectively. So there could be two elements, right, that can explain somebody's bloating, like around the menstrual cycle. But then like, again, to the hormonal argument is like, we always want to make sure we're looking at, is there an ovarian cause? And is this fibroids as well, which like would not necessarily ebb and flow as much as a period, but we want to make sure we're looking at those thoroughly. Yeah.
I mean, certainly our tolerance of discomfort changes during that phase of the cycle as well, right? So things that maybe were fine or tolerable, the non-lactose-free ice cream maybe was tolerable in the first half of the cycle, maybe isn't in the second half. But interestingly, like I think you and I share the same thoughts about this, is that, and I'm curious what you think. I'm going to ask you, like, how much of that ebb and flow with the menstrual cycle should we tolerate, right? Like we do know that people feel differently in that second half. And I'm careful not to pathologize things that are just some of those natural processes, like slight water retention, slight changes in emotion, slight changes in pain perception. At what point do we feel like it's important that people get it addressed versus just tolerating it?
Right. Yeah. I think it's really if it affects somebody's quality of life. Like if somebody says, my period's in a week and I can't go to work because this is really affecting my ability to do things, then we know that that's something that we want to be addressing. And then, like another piece being is the misdiagnosis of endometriosis for IBS, right? So like if somebody's experiencing substantial pain before their period and the bloating and changes to bowel movements, and they're just offered the solution of going on the birth control pill, but or like given the diagnosis of IBS, but actually this is endometriosis, then that's something quite serious that like we would really need to be investigating further because of the implications, right? And the consequences of having endometriosis, especially when women want to be trying to conceive at that point in their life.
Mm-hmm, mm-hmm. Yeah, I agree with you. So it's kind of like that, the amount of time that it takes up in your life, right? And sometimes we may tolerate things in our life. And then there's maybe other like phases of life where like you just don't, it's not possible for a symptom to be taking up as much bandwidth as it is. And then that relative importance is certainly going to be up to the patient. But I think the piece there that I think is worth communicating or saying a second time is that like, we shouldn't just chalk up those symptoms to a benign, because IBS, like it's bad and patients would trade lots to get rid of their IBS, but there isn't like damage happening inside their body necessarily, right? So if they ignored it for 6 months, then they probably would be okay. Whereas from what you're saying, like there's a lot of conditions that do have that progressive nature that will get worse over time if we don't look into it. And if we don't address those gut symptoms in a timely way, then we may be setting ourselves up for some chronic pain. The idea is that we probably should chat with someone, right? We need someone on our team who's like kind of interested in our gut health.
Absolutely. Yeah, totally.
Slightly.
That's a first start in the right direction for sure. But I think also like people need to feel heard, right? Like I think that such a common story I hear is I was dismissed. I was dismissed by my medical doctor. My GI doctor just says, like, this is my story, which is one, stress is good for me. This is what I was told when I was 25. And then my second GI doctor says, oh, you just need to have, literally, he said, you need to have better poops. I was like, well, what does that mean? Right. So I feel like it's a very common story for people to feel unheard, invalidated, and dismissed. But like, if this is affecting your quality of life, and your relationships and your productivity at work and your sleep, like this is not the way to live, right? We really do want to work on this because there is a better way.
Mm-hmm, mm-hmm. And so if you thought about like how people can get started, Dominique, like I'm curious what helps you when people are like coming to an appointment, if they've thought of certain things, if they've tracked certain things, if they're like having a level of awareness about what's going on, I imagine that helps like expedite your process with things like what's helpful for you if you were going to get started with someone on their digestive health, like / bloating journey. Like what would you want them to arrive with or what's helpful for them to communicate with you?
I find helpful is when patients have kind of started to track, like I mentioned before, like intensity and frequency, starting to see if there's any patterns. Oh, like when I went out and had this really high fat food, or I had like that extra scoop of ice cream, or I didn't sleep well, I noticed that my symptoms worsened. Tracking even like kind of emotional triggers or being upset or like getting into a fight with, I don't know, your kids. But then another really important piece to this is like, if it is irritable bowel syndrome that's causing the bloating, it's still like somewhat a diagnosis of exclusion. So I think what's important too is like, has somebody had like the appropriate blood work that has ruled out some other potential causes, like looking at the thyroid or like looking at, let's say, a fecal calprotectin stool test. Some patients will have actually already had an endoscopy and colonoscopy when they come to me. So things are all coming back normal. And then we're starting to like deduce that, okay, I think this is like a functional brain gut disorder. It's really important to me that these other important things like inflammatory bowel disease and celiac disease, and there's several others in there, have started to been ruled out, mostly because some of those tests are actually not in our scope. So I do want to avoid like patient comes to see me and then I'm sending them back to their family doctor and then sending them back to this person. It's kind of like ping pong. But then also like, we want to make sure that something that's more maybe sinister hasn't been overlooked.
Mm-hmm, mm-hmm. It's making me think of like how much information people consume online about bloating. Like if
they say you have cancer, just like everything else, right? Most of the time it's yeah. Very unlikely. Yeah.
I know. I Googled something the other day, like just out of interest. Oh, because I have some like chronic nerve pain on in one leg, which I'm pretty sure is from my training. And I Googled it, and I was telling one of my practitioners that I had Googled it, and he said, "What did it tell you you have cancer?" And I was like, it was on the list.
Yes.
But I also think about like so much of the like functional nutrition and functional medicine, I'm saying an air quote, conversations that happen around bloating, because I think it's it's a symptom that women are self-conscious about, right? And that gives this opportunity for people to be, I don't want to use the word prey, because prey makes it sound like we don't know what we're doing or that we're gullible. And I don't think either of those are true. I think people are looking for hope. And it brings up this opportunity for people to be, fed misinformation about their bloating or promised things about their bloating that just are not true and not possible. I'd love to know what you thought about that. Like, how do you navigate that when you're looking online and seeing all of these promises that are being made to people about their bloating?
Totally. Yeah. I would say, yes, like some of the promises are like, just do this parasite cleanse or just do this other cleanse and everything will be totally fine. It's so much more complicated than that. Like part of bloating most of the time means that we have a dysbiosis. So we have like this, what was a symbiotic relationship of our bacteria is now not necessarily symbiotic anymore. We have an overgrowth or undergrowth. We understand some stuff regarding the microbiome. There's so much information that we don't really know. And like I said before, like there's a lot of systems that overlap with the digestive system. And we want to kind of go through that systematically. So it's really about it's the process. And sometimes it's more about managing the condition than it is about completely eliminating it. And I think that has a lot to do with the research has come a long way, but there's still so much about bloating and irritable bowel syndrome that we just don't know. We just actually don't really know like the cause of it, or even sometimes the pathophysiology of it. And sometimes that can be upsetting for patients to hear, but if we can kind of help with like the expectations and the understanding of the process and the condition itself, then often like our approach to the process, right, and how we view things and how we view ourselves and our body may change for the better.
It's interesting. We had done a podcast about acne like quite some time ago. And one of the things we talked about is like management versus cure. And I felt the same way. I was like, when I'm talking about this, I'm like, I know this is not what anyone wants to hear, but we actually manage acne. We don't cure it, right? Especially adult acne. And the number of messages that we got from people after that episode saying like, thank you for relieving me of the guilt and shame that I had that I was doing something day to day that caused this. That I actually think that we can view that perspective of things being managed versus cured in a very positive way, because especially with digestion and when food is involved and food choices are involved, patients can feel a lot of like shame around them causing their own symptoms when there's a lot of things at play that cause digestive symptoms. It's not your willpower around specific foods. And maybe that's a helpful red flag, right? Like when we see things online that are like, I know the secret cause of your bloating. I'm like, nobody knows the cause of bloating.
I know. Or just do this antimicrobial therapy and everything will be like totally back to normal, which, sometimes helps, but certainly like going from 0 to 100% or 100% to 0 is really, really unlikely. And I've never actually seen that happen before. Mm-hmm. But I do want to make a point, which is like when somebody is kind of diagnosed earlier, right, it can feel like my body is not part of me. I don't understand my body. And this can be seen like when somebody is diagnosed with a chronic health issue and like we have to kind of think about how did we get to this point? Like our body's always trying to protect us. And so like part of the process of all this is trying to foster a healthier relationship like with our body and with our gut, and recognizing that it's part of us, right? It's not separate from the brain. And sometimes that can be really helpful for patients.
Mm-hmm, mm-hmm. I love that. I think that's so helpful, right? People want to be treated as a complex emotional being, right? And we're basically tying that connection to lots of health conditions, including bloating and digestive health. So it's something patients, I think, already identify with. We just have not done a great job of drawing that line between our chronic health issues and our like that complexity of our nervous system and all of that. I think that that's really powerful. I'd love to. So as we're kind of wrapping up, Dominique, like what's your like, soapbox message for patients that are experiencing bloating? Like what did you, when you imagined sort of coming on the show today, that sort of message you want to leave listeners with around this particular topic? And then also how we can get in touch with you, how our bloated people can become less bloated.
Yeah. I'd say a take home is working with the right practitioner actually is quite key. And I don't want to make it like that, being a simplistic message, but like you said, Jordan, there's just so much kind of misinformation or disinformation or just totally like factually incorrect things online regarding bloating. And so having somebody that is your champion and like in your corner to start identifying like what is the full symptom picture here? Like, what do we think is happening can be tremendously important. The second piece is like, stay with the course, like really try, like we're talking about like 6 months to a year. I like to like talk with patients about analogy of like, if you snap your Achilles, right? Like you're not going to start walking next week, right? Or you break your leg. Like these things take a while to start healing, to start progressing. And the same is with our digestion. So those are the 2 key things that I would say would be helpful for listeners. And people can contact me through Clarity Health, your clinic, which is where I work. And I also have a website, drvaniernd.com, as well as Instagram and Facebook, which we will put in the show notes after.
Wow. Awesome. Yeah. Thank you for summarizing that. I think that that's the messaging there is really key around like the length of time that it takes for people to see change. Staying the course is so important, but also having that person, like you said, I love how you're like, some information's like kind of not right and some is just flat out wrong. But it's important because when people feel vulnerable and like they lack hope, that's sometimes those messages can be, we're looking for something that's going to help us or that says an absolute, like this will absolutely help you. And so I think it's so key to remind patients that, we have like, there's a process, but there's also people that will coach them through that. I love that you shared your expertise with us today, Dominique. Thank you for joining me.
Oh, thank you. It was my pleasure.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.